So I will I have to call upon Dr. Amit Porwal, who is the chief instructor of this course. In my stop and chop technique, I was not able to get a good crack. So how do I deal with this? So stop and chop, I think, is the way to go to the next stage of chopping. And so in stop and chop, how do you deal with all this? Over to Dr. Amit, please.
So thank you, Minu sir. And I'm quite sure most of us, when we start our FICO, we start with, that's what we have been teaching and we have been taught. Start with divide and conquer, then move to stop and chop, and then move to direct chop. So stop and chop is the most preferred technique by at least 60 to 70% of the students. So what I'm going to do when I'm not able to get a good crack in my stop and chop technique. Slides move over. Yeah. So this is totally a video-based presentation of 8 minutes, wherein I'm going to cover all the different types of cataracts, which will be a soft cataract, a hard cataract, a sticky cataract, leathery cataract. So everything is covered. So what is important in stop and chop is the depth and length of the trench. This is very, very important. If your depth is not adequate and the length is not adequate, you will end up in not getting a crack. So you can see this was a very complicated cataract, a mid-dilated pupil with a corneal scar and almost a mature cataract. So I'm trying to do the central trench, but this trench was not through and through. The length was not adequate. So I rotated to 180 degree and again I extended the trench. But you see, the length of the trench is less. It is just 5 millimeter. It is within the axis. You will never get a good crack this. So you make sure that when you are going to make the trench, the length should be adequate. You have to go towards the mid-periphery a bit. And when you do that, you have to follow the contour of the cataract. This is very, very important. You can't be scared and just stay in the center and try to just nibble off a few pieces of the cataract and try to get a crack. That is not possible if you have this type of hard cataracts or if you have these sticky cataracts. So this you can see in another video. The axis is done. It's a sticky cataract. Hydro dissection has been done, and there's a hydro delineation area also. In this, I went up to the periphery. But if you see the depth of the trench, it is deep only in the center. But in the periphery, I have not followed the contour of the cataract. So only one punch was given in the periphery, but the whole depth was not adequate according to the contour of the cataract. So I finished the trench over there, and then I continued on the other side after rotating 180 degree. And you have to make sure that the depth is adequate. You can't be just two deep depth wide or one depth wide in the center and then say that I have got adequate depth. The depth should be uniform throughout the length of the trench. Then only you will get a good crack. Once you have got a crack, then chopping into multiple pieces is very, very easy. Now coming to the cracking techniques, you have done a good trench. You have a good trench of adequate depth and length, but still you are not able to get the crack. Why is it so? So the technique of cracking, how you are going to place the instruments, where you are going to place, at what depth you are going to place, this is very, very important. Usually what happens is, we are so scared that we don't go inside, we just remain superficial. You can see this trench is being made. I'm going to try to separate this into two pieces with the help of these two instruments first. But you see, when the width of the trench is not adequate, I'm just in the superficial part of the trench and I'm trying to separate these pieces, but I'm not going to get it. So what I'm going to do now, not to panic, use a good cohesive viscoelastic substance. Use two instruments. There's no shame, there's no hassle in using two Sinskis or two choppers. Now in this also, when you're using, if you're keeping the tip only in the superficial part of the trench, only the superficial cataract is going to get cracked. The posterior plate is never going to crack. So the principle is, when you want to have a good crack, you dip the instrument into the center of this groove, be in the posterior part as much as possible, and uniform force either the same direction or the cross direction. Only when you do that, you are going to get the crack. If you are going to remain superficial, you will never get a crack. So most of these patients I'm showing you is the mid-dilated pupil, because usually these are the situations wherein we are scared to extend the trench to the periphery. When we get a well-dilated pupil, our visibility is more, so we have the adequate length of the length and the depth. But in the mid-dilated pupils is where we get stuck. So in this case, the depth is done, adequate length, adequate depth. I'm trying to get a crack, but I was not able to. Why? Because this was a very soft cataract and a sticky cataract. So how are you going to deal with it? You have done the central trench, you are not able to get a good crack, convert this into divide and conquer. There's no shame in converting to divide and conquer. Divide and conquer is a very good technique. You don't have to worry. In these soft cataracts, when you have deep bulk, basically by doing the divide and conquer, you are debulking the cataract. So when you are debulking the cataract, you have one crack in one of the quadrants, and then you can emulsify it. Again, when you are going to convert into divide and conquer, no shame. Please use two Sinskey hooks. It is nothing that you have to always get a crack with the phaco probe and one Sinskey only. You be gentle, be slow, because every cataract is not the same. Even if you have done 2,000, 10,000 cataracts, every cataract is a new case, it's a new learning curve. So when you are not able to crack, you have got a proper length, proper depth, you have learned the proper cracking technique, but still some of these cataracts, they really don't separate, whatever technique you do. So this is a very soft cataract. I've done dissection, I've done multiple delineation. Now why multiple delineation? You see the way I'm rotating it. We don't want any additions. Multiple delineations have been done. This was very important. When you're doing the central trench, in this soft cataract, you have to break the backbone of the epinucleus. You have to be very gentle when you're going in the periphery. You see over here. You just need to break the backbone of the epinucleus, not the farthest epinucleus which is there, but the layers immediately below before that. Because when you are going to do that, when you're trying to separate, because the epinucleus is cracked, you will get a crack, but it won't be a through and through crack, but the crack will be there only in the periphery. Even if that is there, it is enough, because you see, there's a crack in the periphery, this is a sticky cataract, you're not going to chop. You can't get a good chop in this because the vacuum won't be holding. So what you're going to do? Just hold it and flip it into the pupillary plane. You can see this cataract is just flipped. It's a very soft cataract. Now why it got flipped? Because you're converted into multiple delineated areas. So there are multiple small area rings which are there. So you go on emulsifying one ring from the center, and you can debulk the whole cataract. But if you have not done a dissection, delineation, and you only have a dissected, you have done the dissection, the piece is so bulky that it will never get flipped into the entry chamber. Flipping in the entry chamber is an art which will be achieved only when you have done multiple delineations. Sorry for this video was an old video which has a hazy view. But you can see again in this, it looked like a hard cataract. I thought I'll get away. I will do a my stop and chop technique. But I was not able to. Even if I want to convert into divide and conquer, I was not able to. So there comes the rescue of basically flipping it into the entry chamber and emulsifying the cataract at the pupillary plane. So you can see this is possible only if you have broken the knuckle of the epinucleus. Earlier it was not broken. When it got broke, the whole piece just comes up into the entry chamber, and you can use the other instrument like a fulcrum to push it into the entry chamber, or to flip it or tumble it upside down. You do that and you can emulsify the whole cataract. So these are the tricky situations which you come across, whether it is a soft cataract or anything. Now when everything you have learned fails, you have a bad day, you have done everything, you are losing your patience because you are in a different, your mind is somewhere else and you are operating, how are you going to deal with it? So length is adequate, depth is adequate, cracking also I'm trying, but I'm not going to get a crack. I have converted into divide and conquer, still I'm not able to crack. I'm trying to do flip the nucleus, I'm not getting a flip. So what I'm going to do? And like a beginner, what I'm going to do is I'm going to debulk the whole central core of the cataract. Whatever type of cataract it is, you just debulk the whole central core in whatever way you want. So basically you are going to create an empty saucer. The whole empty saucer will be there, the whole central core you have emulsified, and then with the help of a second instrument, you can prolapse tumble up the whole saucer. Or what you can do is, you break the backbone at one particular area, you get a peripheral partial crack, and then you can prolapse it. So sometimes you might use a bit more energy, but it is better to use more energy than to cause any complication, and you always have a dispersive visco which is going to come to the rescue. So you see, I've tried everything here. I've done the trench, I tried the crack, I've tried the divide and conquer technique, but still I'm not getting it. Then what I do? I just debulk, and then whatever central core hard cataract I get in this divide and conquer, only the centrally I split it, and then that whole piece gets debulked. So this is the way you are going to deal with this type of cataracts. Slide Nimori. So this is what I wanted to discuss in my stop and chop. Thank you. Minu sir, we can have the next speaker.